Hey, crew, welcome to the Older Adult Podcast. My name is Dr. Shelby Blankenship. I am one of your TAs with the Older Adult Division. I primarily do the live courses and then the L2. So if I haven't seen you, hopefully to see you in one of those classes. Today, we're going to be talking about a pelvic case study that I have. It's a current patient, but also a patient that I've seen multiple times, not just this specific one, but in other realms as far as the type of patient. So, pelvic pressure is one that I have seen quite frequently, whether that is actual prolapse symptoms or just that sensation of pelvic pressure. And the patients that I usually see this with have a lot of either caregiving burden or something where they're having to do constant heavy lifting, especially from the ground. So I kind of wanted to talk to some things that I go through as far as examination, but also treatment to see if we can give you a couple of other treatment ideas. And a lot of this will relate to your older adult patients, but also if you see either postpartum folks or even anyone that has to deal with a lot of heavy lifting and trying to manage that pressure system. So, when it comes to the type of patient that's coming in that looks like this, usually they have a tendency for some weakness in their adductors and especially in just like overall posterior chain. But they're having to do a lot of heavy lifting or lifting from a very large range of motion. So, whether that's from the floor to like an upper cabinet, whether that's for work, maybe somebody who works for Amazon or something like that, or in my case, it was somebody who caregives for their grandchildren. So they're having to pick up a baby from the ground pretty frequently and get into those positions. One of the things that I always like to look at, especially with these folks, is what is their deadlift mechanics. Sometimes people tend to be more on the like straight leg hinge side, and sometimes they tend to be more towards the squat mechanics, depending on what is more comfortable for them, especially depending on what their anatomical structure is. Um, for most people, we're wanting to really emphasize the deadlift mechanics from a hinge perspective with that slight conventional positioning where they have a slight bend to their knees, but not totally straight. That tends to be more feels better, especially like on the hamstrings, but also doesn't require as much mobility from the knees and ankles, especially if they're having to do this pretty frequently. And we know that we can always deadlift far more than we can squat. Now, for this patient specifically, she was having issues with pelvic pressure when she was going down to pick up the grandbaby, and especially when she was having to do it slow to make sure she didn't drop the baby, because of course that would not be super great. But especially when she had to do it repetitively. So, especially with those like really, really little ones who don't have much head control, and you're really having to get under them and really brace them well, and it's not just like picking them up from their armpits or they're like lifting their hands where you can pick them up. So think about like a really, really low deadlift. So for her, we kind of really emphasize not only deadlift mechanics, but also the deadlift high pull mechanics. So if you've ever done like a CrossFit level one, they tend to go on to the different functional movements that we do, and one of them is the sumo deadlift high pull. And so we usually kind of scale it back initially, just working on the deadlift. Then we add the deadlift high pull mechanics to that. And then hopefully we can add in the sumo position because one, that tends to make people feel a little bit more stable with that wider base of support. And it gives them more options depending on what the room setup is, if they have the capacity to go a little bit wider or if they need to go more narrow. And it allows them a little bit more range of motion to get down to the ground easier without having to feel like they're, if their ankle mobility or depending what shoes they're wearing limits that range of motion to get to the floor. The high pull obviously like is good because they have to be able to get things to their chest and to their especially if they're getting the baby onto their shoulder. So I really like that mechanic. You can start this with just like a kettlebell if you have access to that. And I usually just start with one and then try to progress to doing one in each hand. One, it requires a little bit more stability, a little bit more core control, but it's just more strength, right? Like if you're having to balance two kettlebells in each hand versus just the one, that's a little bit more balance that's required. And so obviously you're going to be able to get a little bit stronger and add a little bit more of a dynamic to it that most people don't when they just do a single. The other way that I'll also add to this is instead of just doing like a static um, load, is sometimes we'll add more of like an odd object. So whether that's like a sandbag or something, that has, like a tidal tank or something like that that has a little bit more fluidity, like a baby would normally have. That's another way that I will do that deadlift high pull position so that they can work on that core control of that like instability while they're doing that high pull. Because the worst thing I think for most grandparents and the biggest fear that a lot of them have is that they can't take care of the child when they're on their worst behavior. We can all take care of a child when it's on its best behavior, but when it's on its worst behavior, whether that they're super fussy or they're throwing a tantrum or whatever it might be, we want to make sure that they feel really equipped to handle when they start jerking and doing all these kinds of crazy positions. The other functional movement that I really like emphasizing is a sit up. So, whether that might just start with a simple sit up like you would do, whether it's with a band or ones that we would do like in like a gym class or anything like that, and then progress to doing more of like a Turkish get up type of position where they're having to go on one side versus another. That requires so much more core stability and also promotes more of that mobility. So when they're playing on the ground with their grandkid and needing to get up frequently up and down, that's a great way to do that. It also requires quite a bit of pressure management from that abdominal wall. So if you are not able to handle that pressure system, you're going to notice that whether that might be leaking, whether that might be that actual pressure feeling, maybe they're losing gas, whatever it might be, you can really see how much effort it takes for that abdominal or how much pressure and that balance of pressure with their abdominal wall when they're doing something like a sit up or a Turkish get up. And most of our folks are not practicing these movements, and they're so helpful for things like bed mobility besides just the caregiving side. So those are the two big functional movements that I like is the deadlift with the high pull, especially if you can go into that sumo position, and then the sit up, and then maybe progress to like a Turkish get up if appropriate. The other two that I really like focusing on, these are more like specific movements where I'm doing this primarily because I know they've got either some like adductor things or balance things going on, especially with that pelvic pressure, is the Copenhagen planks. So if you're not familiar with the Copenhagen plank, a lot of our pelvic division do really nice posts on that. So I highly recommend kind of looking at those. But it's basically like an upscaled adductor squeeze. So instead of just getting that ball or pillow between your knees, you're in a more plank position. And then you usually have either stacks of pillows or maybe like a couple plates with like a pillow or a blanket on top. And the top leg is the one doing the work. And you're kind of pushing down into the ground to get that adductor really firing, especially in an isometric position. When you're doing that type of exercise, you usually are going to only start with maybe like 10, 15 seconds max with both knees being stable and then progressing to that bottom knee coming up and or making a longer lever arm with you being on your ankle or lower down the lower leg so that you can kind of get more lever and more strength required in that position. When it comes to pelvic pressure, abdominal wall, adductors, those are really big ones that we need to make sure we're emphasizing. And so that's why like the Copenhagens tend to be my go-tos for that. The other side of that is we want to make sure we've got length and strength going on. So that's where I really like Cossack squats. Now you can modify and make these as complicated as you want to, where it can start in more just like a static position where you're getting into that long position of where your toes are forward and more in that triangle, and then just leaning from side to side, and then kind of progressing to where it's more of a squat. But that push off is not only getting some length in that adductor, but it's also getting quite a bit of glute strength that we desperately need with most of these folks. As we all know, when it comes to the pelvic floor, it's that nice little oval, but there's so many structures around that pelvic floor that matter. So going back to our sit-ups, we have to have that abdominal wall and that co-contraction with that erector spinae. We want to also make sure, like with our deadlift and high pull, we're getting that posterior chain going and that breath work. And we want to make sure that we're doing it in not just ranges of motion where our legs are together or really tight like a conventional deadlift, but getting it into a wider base of support to allow a little bit more range of motion, require that pelvic floor to do a little bit more work, especially if we're not able to modify modify or scale the breathing techniques and symptoms so that we're not having that pelvic pressure. So, just to kind of recap, pelvic pressure, one that we constantly see with a lot of our folks, it might be prolapsed symptoms, might not be, but especially when people are having to do heavy lifting or heavy loads from the ground to overhead or just to shoulder height, this is something that we tend to see, especially when they're having to do wider base of support. Maybe because the lift or the weight is heavier. So we really like to focus on the functional movements of like a deadlift high pull or a sumo deadlift high pull if we can. And then also a sit up to kind of help really practice pressure management and make sure we're doing a nice brace if appropriate or breathing out if that's appropriate, kind of seeing which pressure management side works best. And then we can go to some specific tissue work, whether that's our Copenhagen planks with really emphasizing that adductor squeeze and isometric control, and or the Kozak squat where we're working on both length of the adductors and strength with combination of that glute and getting a little bit of single leg balance here, because especially like with stairs and those kinds of things, it's sometimes that pressure not only is in the deadlift but also in when we do single leg things, because they notice that like oof, especially when I'm carrying load, I'm having a lot harder time managing that pressure and that strength because I'm more on that single leg position. Hopefully, this was helpful. Just know that we've got not only a pelvic portion of our class in the older adult L2, but also we have a whole division, pelvic, that I highly recommend you checking out if you haven't yet, because we have a lot of folks that have a lot of things, not just with pelvic pressure, but leakage and managing menopause and managing all types of pelvic floor symptoms, whether it's male or female, that would really appreciate any insight and any help that you're willing to give. So definitely check out those classes. But as far as the older adult division, we've got a couple live classes coming up. September 27th, we're going to be in Burlington, New Jersey. And then we will also be in Scottsdale, Arizona. And then L1 is currently going on, and we will have a new cohort starting October 22nd. And then L2 is going to be starting in a couple of weeks on September 18th. So hopefully we can check y'all there. And we really appreciate y'all watching this podcast.